Hi everyone, my name is Cassandra Tootin and I'm the Special Projects Coordinator at the Rosalind Carter Institute in Americus, Georgia, and I'd like to welcome everyone to the Cognitive Status Screening for Older Adults presentation. It'll be presented today by Dr. Felicia Goldstein. Dr. Goldstein is a professor in the Department of Neurology at Emory University School of Medicine, and that's in Atlanta, Georgia. Her clinical specialization is in geriatric neuropsychology with a focus on the early detection of cognitive changes associated with mild cognitive impairment and Alzheimer's disease. She is board certified in clinical neuropsychology and is a fellow of the American Psychological Association. In 1989, Dr. Goldstein established a specialty neuropsychology clinic to provide support for the Department of Neurology Memory Disorders program. Through this active clinical service, she continues to supervise and mentor undergraduate and graduate students in clinical neuropsychology. Dr. Goldstein conducts clinical research on health disparities, the contribution of vascular comorbidities to disease features and progression in older adults, and the early detection of mild cognitive impairment and Alzheimer's disease. She has over 70 publications in peer-reviewed journals and serves on the editorial board of several journals, including Ethnicity and Disease. And at this time, I'd like to turn it over to Dr. Goldstein to start her presentation.
Okay, well, thank you very much for that introduction. I'd also like to thank the Georgia Division of Aging Services for the opportunity today and in the past, of course, to work with them on identifying cognitive measures to screen for cognitive impairments in older community-residing adults, and also, of course, to provide this education and training webinar. So what I plan to accomplish today is to, first of all, provide you with a background for why it's important to screen the cognitive status of older persons. And then following this, I'm going to provide you with the necessary training for administering the telephone items and the in-person cognitive instruments that have been selected for this initiative. So by way of background, this slide shows you the breakdown in the projected percentage of different age groups in the United States from the year 2015 over the next 45 years. And as you can see by the blue colored bars at the bottom of the screen, by 2060, slightly less than 20% of Americans will be younger than 18 years old. This is down from an estimated 22.9% in the year 2015. In contrast, persons who are older, 65 years and older, represented by the purple bars on top of the screen, will account for 23.6% of the population, and this figure is up from 14.9% in 2015. So basically, we are seeing a change in the composition of the U.S. population such that older persons are outnumbering younger people. So this shift in the percentage of older adults in the general population is also true for the state of Georgia. In the year 2000 and 2010, about 10% of Georgians were 65 years and older. By 2030, shown by the bar on the right, this figure will rise to almost 16%. In general, the reasons why there's an increase in the aging demographics are attributed to the fact that, first of all, people are living longer because of better technology, medical technology, and care. And also the baby boomer generation of persons born in the 1950s are now turning 65 years and older. We know that there are some changes that occur in normal cognitive aging, and that these are inevitable as we get older, and that these changes can occur even before age 50. Common changes typically involve slower speed of processing, both motorically and also in terms of information processing speed, but also there are changes as well in memory, usually for recent event short-term memory, and also reasoning and problem-solving ability. The problem occurs when these cognitive changes begin to impact everyday functioning for the individual. For a number of older persons, cognitive changes can become severe enough to impact their ability to independently manage their activities of daily living, such as cooking. They may leave the stove on, being able to take their medications, forgetting to take them may occur, not paying bills, and getting lost while driving, which impacts their ability to travel. When this occurs, when these cognitive deficits become severe enough that they impact the person's ability to independently function, we say that the person meets criteria for dementia. And dementia involves cognitive deficits in at least two areas of ability: memory, executive functioning, language, etc. And again, that are severe enough to interfere with the person's ability to perform instrumental activities of daily living. This slide shows you a pie graph of the different types of dementias. And as we know, and of course we're most familiar with, Alzheimer's disease is the most common cause of dementia in older persons. About 60 to 80% of older adults have Alzheimer's disease, and the greatest risk factor for Alzheimer's is advanced age. But there are other causes as well shown here. Dementia with Lewy bodies and vascular dementia from strokes, for example, are also very common. So one goal of cognitive screening that you're going to be performing is to identify persons who have mild cognitive impairment prior to the development of dementia. And persons with mild cognitive impairment exhibit cognitive changes beyond what you would see in normal aging in areas like their memory, language, and reasoning abilities, but these folks are still functioning relatively independently. They're typically able to live alone, they may be working, they're able to get around and drive and take their own medications, etc. In terms of the incidence or prevalence of mild cognitive impairment, studies find that about 16 to 21% of adults who are 70 years or older have mild cognitive impairment. And we know that mild cognitive impairment is a risk factor for the transition to dementia, especially Alzheimer's disease. There's an average conversion rate of about 10 to 15% per year to dementia from mild cognitive impairment in community-based samples. So the question is, what does it matter? Why is it important that we detect people who are exhibiting cognitive problems and mild cognitive impairment? Well, first of all, there is evidence that treatment implemented early can have the biggest impact rather than waiting until somebody is exhibiting severe deficits. Next, there are some reasons for cognitive impairments that may be reversible. Persons can have cognitive difficulties due to medication side effects, high blood pressure, depression, and other reasons. So it's critical that we are able to triage these persons for more in-depth workups and hopefully be able to reverse the cause of their problems. And finally, early identification can lead to lifestyle changes and recommendations, such as altering someone's diet or encouraging exercise. And we know that these interventions can make a difference as well. So I'd like to now move towards discussing the cognitive screening tools that are going to be administered as part of our initiative to detect early cognitive changes in persons. And basically, these questions and instruments fall into two phases. The first phase involves telephone screening, and this is when you will briefly evaluate the caller's memory and their executive functioning, reasoning ability. Questionable performance on these items are then going to serve as a trigger that will determine whether or not a more detailed evaluation is needed. If you answer yes to this question, this evaluation will then occur in a person's home, or for some persons it may occur via telephone. I wanted to mention that the purpose of the cognitive screening that you'll be doing is not meant for diagnosis. So in other words, performance is not meant to tell you what's causing the person's questionable performance. But again, it can serve and it will serve as a trigger that they may need additional workup of their cognitive status. So just general rules of test administration. For both the telephone and the in-person assessment, there really are critical rules that it's very necessary to follow. First, it's very important to read the instructions as you see them written on the forms, the workbook pages that you'll have, rather than paraphrasing them. This is necessary to ensure standardization across different screeners and also to ensure that subtle changes in wording don't affect the person's score. Next, it's important that you don't provide feedback on whether the person's response is correct or incorrect, or give them the answer. Some people are going to ask you whether they remembered all the words you read to them, what word it was that they didn't remember, etc. And if this happens, just say, I'm sorry, but I'm not allowed to tell you. We do this all the time with our geriatric evaluations with our patients, and they seem fine with it. We've not had any difficulty, but they seem to understand that you're not able to tell them. And finally, some persons may become very upset or frustrated over their performance. Provide them with encouraging comments such as, I appreciate how hard you're working, or I know you're really trying your best. But again, don't tell them how they're doing on the tests. In other words, oh, you passed all of that, or you didn't get that right, or anything like that. So let's move to phase 1, which is the telephone screening items. Before you start working with someone on the phone, ask them to turn off any distractions such as the TV or radio. Make sure nobody else is in the room with them. Ask them not to use pencil and paper when they're answering these questions or working with you. And start it off by saying, I'm going to ask you some questions to evaluate your memory and thinking abilities. Some questions may be easy and some may be difficult. Just do the best you can. Are you ready? And once you get their go-ahead, you'll start with a series of 4 items. For item 1, this is a memory test where you're going to read a list of words to the person and have them recall them. And here you say verbatim, this is a memory test. I'm going to read to you a list of 5 words to remember. Listen carefully. When I finish, please tell me as many words as you can remember. It does not matter in what order you say them. You will then read the list of words below, shown as trial 1, at 1 word per second. You repeat a word if the person says they didn't understand what you said. That's fine to do. So if you say velvet and they said, what did you say? You can repeat it. After you've read the 5 words, the person repeats them after the last word, and you can just place a check mark if you want for every word they recalled, although this won't be scored, this part of it. Give trial 2, even after they do trial 1, even after they recall all 5 words, you still need to do trial 2. So trial 2 is always going to be given. For trial 2, you'll say, here are the words again. When I finish, tell me as many words as you can remember. And at the end of this, importantly, at the end of trial 2, say, please remember these words. I will ask you to recall them later. So in fact, you want to warn them that later on you're going to be asking them to remember these words. Item 2 is oral trail making, and for this you'll need some sort of a timer. You can use your phone as a timer or stopwatch, whatever you have available, but you do need to time this. Part A for oral trail making requires that the person count out loud. For this you're going to say, I would like you to count from 1 to 25 as quickly as you can. 1, 2, 3, and so on. Are you ready? Begin. At that point, you start timing after the instruction. Now, if a person says, I don't understand what you want me to do, can you repeat that? You can repeat that once, the instruction again verbatim, but if they again say they don't understand, just move on to the next item. At the end of this, you'll record the number of seconds it took them to complete it, and you're going to give them a maximum of 60 seconds. If they are past 1 minute and they're still counting, you could say, let's move on to something else. Now, if a person makes a mistake, you need to correct them. So you need to be watching this or listening carefully to this as they're doing it. So let's say they say 1, 2, 3, 5, 6, and they've omitted the number 4. You'll say to them, you last said 3. Please continue from there. So you get them back to the last correct number they did say before they made their mistake. But don't stop the timing. So you'll always keep the timer on, even if you have to correct their mistake. So that will always be running. Item 3 is an oral trail making test as well, for which you need a timer. But in this test, the person alternates between saying numbers and letters. You say to the person, now I would like you to count again, but this time you are to switch between number and letter. So you would say 1A, 2B, 3C, and so on until I say stop. Are you ready? Begin. Again, if the person says, can you repeat that? I don't understand what you want me to do. You can repeat the instructions verbatim, but after that, if they still don't get it, move on to the next item. Again, you are going to record number of seconds to complete, and the same sort of rule follows here. If the person makes a mistake, 8H, 9, 10, you would put them back by saying, you last said 8H. Please continue from here and get them to go on. Do not stop again if the timer, don't stop the timer if a mistake is made. And on this test, you will give them a maximum of 2 minutes, so 120 seconds. Item 4 is the last item for the telephone screener. Here you're going to obtain their delayed recall of words. And this should be done at 5 minutes. So after you've read them the list of words for item 1, pay attention, you can write down what time that ended, and then make sure that when you do item 4, 5 minutes have passed, because we want that to be the delay. In most cases, it's likely that you won't have had 5 minutes interval. You can fill it with conversation if you want, and just talking to the person. Well, at 5 minutes, you'll say, I read a few words to you earlier, which I asked you to remember. Please tell me as many of those words as you can remember. Don't worry if you can't remember all of them. The person will recall the words for you, place a check mark in the box below for the word that they did recall, and the score on this is the total number of words they've successfully recalled. If they say a word that wasn't on the list, that doesn't count. A word that is sort of in the same category but is not the exact word wouldn't count either. So at the end of this telephone screening, you will score their performance, the person's performance. For the scoring of delayed memory, on the top I've shown you the breakdown of age for 50 to 79 years old or 80 and older. Performance is okay for a 50 to 79-year-old if they recalled 3 to 5 words. But if they only recall 0 or 2 words, then their performance will be questionable on this. For someone 80 and older, 2 to 5 words recalled will be okay. But again, if they don't recall any words or only one, their performance on this test will be considered to be questionable. For the letter number sequencing, you're only going to be paying attention to the alternation between numbers and letters here, and that's the score that you'll be looking at. Here you have a breakdown by 50 to 59 years old, 60 to 69 years old, and 70 and older. For persons who are 50 to 59, performance on Trails B, that alternating task of less than 56 seconds, would be okay. 56 or more seconds questionable. An older person, 60 to 69, I've shown you less than 70 seconds is fine. 70 or more seconds is questionable. And finally, 70 and older, person who takes less than 73 seconds is okay, but 73 or more seconds is questionable performance. So this is important, these two scores, because it's going to determine whether or not there's a trigger for follow-up testing. If performance on both of the tasks is okay, in other words, you didn't detect any questionable scores, you'll assign a score of 1, and follow-up for cognitive testing or further screening will not be deemed needed. However, if the person has questionable performance on one or both of these tests, you'll assign a global score of 2.54, and that will be a trigger that follow-up screening is needed. In this case, the Montreal Cognitive Assessment, or the MoCA, will be administered in person, or the MoCA Blind, which I'll go over very briefly. It's really a modified version of the longer MoCA, will be administered via telephone. So now I wanted to go over the more in-depth screening with you when someone is triggered that they need more evaluation done. The Montreal Cognitive Assessment, or the MoCA, shown here, I've shown you the website for it if you want more information about it. Information taken for this webinar is from their site. It's developed by Nasruddin and colleagues. It's been increasingly adopted as a screening tool. It consists of items that evaluate memory, language, visual motor ability, attention, and executive functioning. And it's found in several studies to be very sensitive to detecting mild cognitive impairment and dementia, and it takes approximately 10 minutes to administer. So I'm going to run through the items with you one by one, and we'll go through these now. The first set of items shown here on the right fall into what's known as the visual spatial executive domain. So there are 3 items, as you see. On the left are numbers and letters in circles, similar to what was done with the oral trail making Part B test. We'll say to the person, please draw a line going from a number to a letter in ascending order. Begin here. You'll take your pencil and point to 1 and draw a line from 1 then to A, then to 2, and so on. End here. You'll now point your pencil to the letter E. If the person, for any of these items I'm telling you about now, says they don't know what you meant, you can repeat the instructions once. But again, if they don't get it after one repetition of the instructions, say, let's move on to the next task. Don't worry about it. Let's just move on. The next item is the rectangle, and you'll say, copy this drawing as accurately as you can in the space below. And the third item you'll give is the clock task. You'll say, draw a clock, put in all the numbers, and set the time for 5:04. It's okay to repeat the time to them. So if they ask you, what time did you say, that's fine. This isn't a memory test. It's an executive functioning reasoning test. So over here I've shown you on the right the scoring criteria for each item. The maximum score for all of the items is 5 points, shown in the right column. You can see that points. The person for the first item gets 1 point if they draw the following pattern: 1 to A, 2 to B, 3 to C, 4 to D, and 5 to E, without drawing any lines that cross each other. If they if they self-correct an error they make, that's fine. But if they don't self-correct, then they get 0 points. They get 1 point for the design if it's three-dimensional. All the lines are drawn correctly. No extra lines are shown on it, and all the lines are parallel, and their length is similar. They really, depict a three-dimensional rectangle. For the clock, you give them a maximum of 3 points. They get 1 point if they draw a circle. Nothing else is acceptable, a cube, anything like that. It has to be a circle or something that looks like a circle. It doesn't have to be perfect, but it has to be obviously something that's round. They have to put they get 1 point if they have all of the numbers present and in the correct placement. The numbers can be outside the circle. They still get a point for that. And they get a point for 2 hands that are joined in the center of the circle that point to the correct numbers and that the length is correctly depicted to show the time 4:05. So basically, you could look at that at another time and see the time and see that it was set correctly. The next items on the MoCA have to do with naming ability. And on the left, you see the 3 items they get. Beginning on the left, you'll point to each figure and say, "Tell me the name of this animal." For scoring, they get 1 point for each correctly named. Giraffe is 1, bear 1 point, and hippopotamus or hippo is correct for the third one. So if they shorten the word, that's fine. No other items are acceptable or names are acceptable. For memory, this is similar to what we just talked about earlier on the telephone. You will say, "This is a memory test. I'm going to read a list of words that you will have to remember now and later on. It doesn't matter in what order you say them." You read the words at 1 per second, and then at the end, ask the person to tell you what they remember. And again, even if they recall all 5 words on trial 1, you always give a second trial. You say, "I am now going to read the same list for a second time. Try to remember and tell me as many words as you can, including words you said the first time." At the end of this, again, importantly, you tell them, "I will ask you to recall those words again at the end of the test." No points are given for trials 1 or 2, so this is an unscored item. You're basically just trying to get them to encode the words so that you can then test their delayed recall. For the attention items, there are 2 shown here. One is digit span. They're asked, first of all, for forward digit span, you say, "I am going to say some numbers, and when I am through, repeat them to me exactly as I said them." You read each digit at the rate of 1 digit per second, and then for backward digit span, you say, "Now I am going to say some more numbers, but when I am through, you must repeat them to me in the backwards order." So 8, 5, 2. The person should obviously say 2, 5, 8 to get a point for that. You can't repeat these digits again. So if they say, "What were those numbers you told me?" you say, "Let's move on to the next item." You can't repeat them. But you could repeat the instruction if they said, "I don't know what you're asking me to do here." But you can repeat it once. So 1 point is given for forward digits and 1 point for backward digits, getting it in the correct sequence. For the vigilance test shown at the bottom of that picture, you're going to read a list of letters. So you say to them, I'm going to read a sequence of letters. Every time I say the letter A, tap your hand once. If I say a different letter, do not tap your hand. Here you read each letter per second, F, B, A, C, etc. And pay attention to whether or not they tapped to the letter A, or even if they tapped to the wrong letter or they omitted an A. I usually just put a cross through to indicate that that's an error so that I can score it. The scoring criteria for the vigilance task give 1 point if there is no error or one error. That's okay, but if they make more than one error, that gets 0 points. Serial sevens is a test where you ask somebody to count backwards for you. So in this version, you're going to say, now I will ask you to count by subtracting 7 from 90, and then keep subtracting 7 from your answer until I tell you to stop. Again, you can repeat instructions, and here you can repeat them twice if the person's confused and doesn't understand the task. You stop them after they give you 5 answers, subtractions, regardless of whether they're correct or incorrect, but they have to give you 5 responses. And if, of course, they say, I just can't do this, or they start and they just say, forget it, that's okay to discontinue. So each subtraction here for scoring is evaluated independently. If the person responds with an incorrect number, but then they continue to correctly subtract 7 from it, you can give them a point for each correct subtraction. So let me show you an example. Here on the left is what they should say. And let's say they say instead 82, 75, 68, 61, and 54. Well, the 82 is incorrect because they should have started out with 83. But then they're saying they're correctly subtracting 7 from each number. So you'd only give them 1 incorrect response here. The other 4 are correct. And looking at the bottom, if they get 4 to 5 correct, you'd give them a total of 3 points on this task. And, of course, 0 points, none correct, 1 point for 1 correct, and 2 to 3 correct would be 2 points. So it's good to write down exactly what they say so that you can then score it later on. For the language measure, you are going to ask them to repeat some sentences to you. So in this test, you're going to say, I'm going to read you a sentence, repeat it after me exactly as I say it. So what's important here is that they not put any words in, omit any words, or do anything different than exactly what you said. So the first sentence is, a bird can fly into closed windows when it's dark and windy. They need to repeat this back to you exactly as you said it. If they say, when it is dark and windy, wouldn't be okay. If they said when it's dark or windy, so anything that's not the exact wording doesn't get a point. And after they repeat the first sentence, you say, now I'm going to read you another sentence, repeat it after me exactly as I say it. So the maximum score for these 2 sentences is 1 point each, so a total of 2 points. Also, under the language domain, you're going to examine what's called verbal fluency. Here the instructions are, tell me as many words as you can think of that begin with a certain letter of the alphabet that I will tell you in a moment. You can say any kind of words you want except for proper nouns like Bob or Boston, numbers, or words that begin with the same sound but have a different suffix. For example, love, lover, loving. I will tell you to stop after 1 minute. Are you ready? Now tell me as many words as you can think of that begin with the letter S. You time this for 60 seconds, and you give them a maximum of 60 seconds, and write down everything they say so that you can score it. They get 1 point if they can generate 11 words or more in 1 minute or 60 seconds. If people need repetition of the instructions, that's fine. And generally, if someone's just sitting there and 15 seconds have gone by, I will say to them, can you think of any more words? So but if they say words that are the same, like sit, sat, sitting, those other two don't count because they're really the same word but different version of it. So you want the words to be unique and not be capital words, proper nouns. For abstraction on the MoCA, you're basically going to be asking people to tell you how two items or words are alike, how they're the same. So for the instructions, you start out by asking them, tell me how a carrot and a potato are alike. If the response is concrete, they're round, they have color, whatever, and they're very concrete, or incorrect, you can say, tell me another way in which those items are alike. If they're still giving you somewhat of a concrete or a incorrect answer like you eat them, you would say yes, and they are both vegetables, which is really the more conceptual answer you're looking for. After you've given them that example, you then say, tell me how a diamond and a ruby are alike, and tell me how a cannon and a rifle are alike after they've given you the first answer. You give it 1 point for each correct response. So I've shown you on the right, correct responses for diamond and ruby, that would get a point, and for cannon and rifle, that would get a point. 0 point responses for diamond ruby would be something like from the earth. Cannon and rifle, fire, shoots, uses ammunition. So on this diamond and ruby, if they said precious stones, jewels, something like jewelry, that would be okay. They can do a little modification of that, but it needs to be a more conceptual, higher level response that they give to earn a point. Now, memory will be tested again, delayed recall. At the bottom of the form that you'll see when you're doing this test, there are going to be the words again, and it will say, I read some words to you earlier which I asked you to remember. Tell me as many of those words as you can remember. And here you will put a check mark for the boxes that say with no Q, and you'll give the score will be the number of words they recalled. Ignore the optional category Q, multiple choice Q portion of this test. We're not going to be doing that in this trial or in this initiative, but you will want to get their exact recall of the words, and you'll give them 1 point for each word that they were able to spontaneously recall on their own. And finally, for the MoCA, the last items test orientation to place and time. Here you're going to say, tell me the date today. And if the person doesn't give you the answer, or they don't give you the full date, you can do it piecemeal by saying what is the year, what's the month, what's the date, what day of the week is it. So you can cue it individually if that will elicit the answers you need. And place and city. You'll want to ask them those questions as well. That gets a maximum of 6 points. At the end of the MoCA, at the end of the test, you will sum all of the subscales. The maximum score that someone could get on the MoCA is 30 points. You can assign an extra point and should assign it if the person has 12 or fewer years of education. And so a total score on this test of 26 points or more or higher is within normal limits. So less than 26 points would be considered a possible flag that this person needs to see their primary care provider in order to get further workup. The MoCA blind is given to people over the telephone or people who have visual impairments. It's identically administered as the full MoCA, but the items that require people to copy and draw figures or to name pictures are eliminated, so that the total score that someone could get is 22 points. And again, you'll assign an extra point if the person has 12 or fewer years of education. A total score of 18 or more points on this test is considered within normal limits, but less than 18 would be a flag that the person may need further workup. Well, that concludes the cognitive portion of the screening initiative today, and I hope that I've made it clear to you about administering these measures, and I hope that all goes well in working with older people. Thank you very much.
Okay, thank you, Felicia, for taking the time to present this information to us today. And I'm certain that all of this information that you've provided will be incredibly useful in future screenings. I'd also like to take a brief moment to thank our audience who will be watching this a little bit later for taking the time to join us today to learn more about cognitive status screening for older adults. I'd also like to remind everyone to take the post-test that's going to be provided for this webinar as well. You can find the link to that post-test. It should be below the link that you clicked on to access this webinar. So please just take that when you've completed watching this after you're finished. Felicia, did you have anything else you'd like to add?
No.
Okay, all righty. Well, again, thank you, everyone, and thank you, Felicia. It's been a pleasure hosting this webinar with you. And at this time, I'm going to be ending this recording.